Good morning, everybody. Today's lecture is about the thoracic cage and its joints. We are going to describe the thoracic cage, the bones forming this cage, the joints acting on it, and also we are going to describe the inlet and outlet of the thoracic cage. First of all, what is the thorax? The thorax or the chest, it is the region between our neck here, as you see by the pointer, and the abdomen. So the thorax or the chest, it is this region. It is the region between the neck and the abdomen. If you look at this picture, this shows the bony framework of the thoracic cage. So the thoracic cage is formed of bones and cartilages, the sternum and the vertebrae. So the thoracic cage is formed of bony framework. What is the function of the thoracic cage? The thoracic cage protects our vital organs, which are the lungs and the heart. It also gives attachment for the muscles of the thorax, the upper limb, the neck, and the abdomen, as you see in the picture. Now we are going to start the thoracic cage framework, bony framework. The thoracic cage is formed of 12 pairs of ribs. As you see, these are the ribs and their costal cartilages. Because the ribs, they don't reach directly to the sternum. So we have the ribs and their costal cartilages. Posteriorly, we have the vertebrae, and in front, we have the sternum. So the thoracic cage is formed of 12 pairs of ribs with their costal cartilages, 12 thoracic vertebrae, and the sternum. Now let's begin with the thoracic inlet. What do we mean by the thoracic inlet? The thoracic inlet is the upper aperture of the thorax through which passes nerves, vessels, and organs like the trachea, the esophagus. All these structures form a communication between the neck and the thoracic cavity. So, superiorly, the thorax communicates with the neck through the thoracic inlet. This is the thoracic inlet. This is the thoracic inlet. It transmits many structures, as you see here. You see the trachea, the esophagus, the vessels, arteries, veins, and nerves. If you look at this picture, you can see this is the first rib, this is the manubrium, and behind is the first thoracic vertebra. The inlet is oblique, it's not directly transverse, so it's sloping downwards and forwards due to the obliquity of the first rib. So the thoracic inlet is oblique, it's sloping downwards and forwards. Why? Because the first rib doesn't lie transversely, it lies obliquely. If you look at this picture, we can see the anteroposterior diameter and the transverse diameter of the thoracic inlet. It is clear from this picture is that the anteroposterior diameter is shorter than the transverse diameter of the thoracic inlet. Now, what are the boundaries of the thoracic inlet? This is the thoracic inlet, and as you see, it's inclining forwards and downwards. If you look here, you can see the first thoracic vertebra. This is the manubrium sterni. This is the sternum. This part is called the manubrium sterni. So here This is the manubrium sternal. This is the first thoracic vertebra, T1. And on the sides, you can see the first rib and its costal cartilages. So, the boundaries of the thoracic inlet. Posteriorly, it is formed by T1, first thoracic vertebra. Anteriorly, it is formed by the superior border of the manubrium sternal. On the sides, laterally, it's formed by the first rib and its costal cartilage. This is the boundaries of the thoracic inlet. Now we are going to speak about the thoracic outlet. Thoracic outlet is the inferior part of the thoracic cage. Okay, it is separated, this opening is separated from the abdomen by what is called the diaphragm. In Arabic, it's called al-hijab al-hajiz. So, inferiorly, the thorax is separated from the abdomen by the diaphragm. Okay? Through this diaphragm passes structures from the thorax to the abdomen and vice versa. Now, if you look also here, you can also see that the transverse diameter is wider than the anteroposterior diameter. Okay, like the thoracic inlet. Here, this is the thoracic outlet. This is the diaphragm, and as we said, the diaphragm separates the organs in the thorax from organs in the abdomen, and it allows the passage of structures from the thorax to the abdomen and vice versa. What are the boundaries of the thoracic outlet? If you look at this picture, you can see this is thoracic vertebra number 12. It is T12. Here you can see the xiphoid process and the costal cartilages of the ribs from number 7 till number 10. Okay, and laterally you can see rib number 12 and rib number 11. This is the last rib and this is number 11. So our boundaries, posteriorly it is formed by thoracic vertebra number 12. Anteriorly it is formed by the costal cartilages of the ribs from 10 till 7 and by the xiphoid process. The costal cartilages from rib number 10, 9, 8, 7 form what is called a costal margin. So anteriorly, the thoracic outlet is formed by the costal margin and the xiphoid process. Laterally, it is formed by the ribs, the last two ribs, number 11 and 12, with their costal cartilages. These are the boundaries of the thoracic outlet. Now, test yourself. What is the anterior boundary of the thoracic inlet? Try to answer it from what you heard. Now we are going to study the joints of the thoracic cage. We have joints of the sternum. We have joints between adjacent vertebrae, and we have joints of the ribs. We will begin by the joints of the sternum. We are going to study the manubriosternal joint, the xiphisternal joint, the costochondral joints, the sternocostal joints, and the intercontrol joints. Costo means rib, chondral means cartilage. So costochondral joints, these are the joints between the rib and its costal cartilage. Sternocostal joints are the joints between the costal cartilage and the sternum. Intercontrol joints means joints between the cartilages. As you see here, this is the cartilage of rib number 10. It joins that of number 9. The 9th cartilage joins the 8th. The 8th joins the 7th cartilage. So intercontrol joints are joints between the ribs. Now let's begin with the joints of the sternum. The first joint, if you look at this picture, you have the sternum. The sternum is formed of 3 parts: manubrium sterni, body of sternum, and xiphoid process. The first joint is the manubriosternal joint. This joint marked by the red circle. This joint is a secondary cartilaginous joint. So the type of the joint is a secondary cartilaginous joint. It is a joint between the manubrium sterni and the body of sternum. This joint allows only a small amount of angular movement needed during respiration. So the manubriosternal joint is a secondary cartilaginous joint. It lies between the manubrium and the body of the sternum. It allows a small amount of angular movement during respiration. The second joint is the xiphoid joint. If you look at this picture, this is the body of sternum, this is the xiphoid process. So this is the xiphoid joint. This joint is also a secondary cartilaginous joint. It lies between the body of the sternum and the xiphoid process. This xiphoid process usually fuses with the body of the sternum at the middle age or during the middle age of the person. So here I have 2 joints, manubriosternal joint and xiphoid joint. Both joints are secondary cartilaginous joints. Now we are going to see or to study the costochondral joints. As we said before, costo means ribs, chondral means cartilage. So costochondral joints, these are the joints between the ribs and their costal cartilage. If you look here, this is the rib, this is its costal cartilage. The rib and its costal cartilage. So I am speaking about these joints. These joints are cartilaginous joints. They permit no movement. So these joints, no movement occurs at these joints. No movement occurs at the costochondral joints. Now the sternocostal joints. The sternum means the sternum, costal means costal cartilage of the ribs. So here are the sternocostal joints. They are the joints between the costal cartilage and the lateral border of the sternum. Let's count: first, second, third, fourth, fifth, sixth, and seventh. So the upper 7 costal cartilages articulate with the sternum by the sternocostal joints. The first sternocostal joint is a primary cartilaginous joint. So this joint is a primary cartilaginous joint. It permits no movement at all. From second sternocostal joint till the 7th sternocostal joint, they are synovial joints. So second, third, fourth, fifth, sixth, and 7th costal cartilages, they articulate with the sternum through sternocostal joints. These joints, as we said, they are synovial joints. The interchondral joints. The inter means between, chondral means costal cartilages. So these are the joints between the costal cartilages. If you look at this picture, let's count again. First, second, third, fourth, fifth, sixth, and seventh. So here you can see a joint between the seventh costal cartilage and the sixth costal cartilage. And then you have a joint here between the eighth costal cartilage and the seventh costal cartilage. So the intercondylar joints, they are the 6th, 7th, 8th, 9th, and 10th costal cartilages articulating with one another at their borders by what we call also synovial joints. These joints, they are small. So the intercondylar joints, they are the joints between the 6th, 7th, 8th, 9th, and 10th costal cartilages by small synovial joints. What about the costal cartilage of rib number 11 and 12? These cartilages are embedded in the muscles of the abdomen. So the cartilages don't join each other. So I don't have intercondylar joints between rib number 11 and number 12, nor between number 11 and number 10. So the cartilages of rib number 11 and 12 are embedded into the abdominal musculature. By this, we finished the joints of the sternum. Now we are going to begin by the joints between the vertebral, between the vertebrae on the posterior aspect of the thoracic cage. Before we speak about these joints, let's look at the vertebra. As you look in this picture, you are going to take this in full details in the practical session, but let's take speak about it for a while here. This is the body of the vertebra. It's formed of what is called pedicle, this one, and then pedicle on the right side and on the left side. Each pedicle gives a lamina. This is a lamina and this is a lamina. The two laminae unite together forming a spine. So I have a body, a pedicle, a lamina, and the two lamina gives me a spine. At the junction or at the union of the pedicle with the lamina, I can see superiorly here what is called superior articular facet. On the inferior aspect, I have also what is called inferior articular facet, and laterally I have a transverse process. So, at the junction of the pedicle with the lamina of the vertebra, I have three articular processes: superior articular process, inferior articular process, it's not seen in this picture, I will show it to you in the next slide, and the transverse process. Here, this is a superior view and this is a lateral view. This is the body of the vertebra, this is the body of the vertebra. This is the pedicle. Here I cannot see the pedicle because I have on it what is called superior costal facet. But this is the, anyhow, this is the pedicle. Okay, so the body, the pedicle, this is the pedicle. And then this is the lamina. Here I cannot, this is the lamina and the spine. Here I cannot see the lamina, but I can see the spine. At the union of the pedicle with the lamina, I have superior articular facet. Here is the superior articular facet. This is this one and this one are the inferior articular processes carrying inferior articular facet. Here, this is the inferior articular process. This is the superior articular process and facet, inferior articular process and facet. And then I have the transverse process with its costal facet. Here I can see superior articular process with its superior articular facet. I cannot see the inferior one. Here is the inferior one. This is the transverse process with its transverse costal facet. And this is the spine. Again, another picture to show you that the vertebrae are joined together. This is the transverse process, this is the lamina, this is the spine. Here, this is the transverse process, this is the two lamina forming the spine, and this is the pedicle, and this is the body of the vertebra. Now we are going to begin with the joints between the bodies of the vertebrae. This is a vertebra, this is another one. Okay, so the bodies of the vertebra, the upper and lower surface are connected. This is the upper surface, this is the lower surface. They are connected by the intervertebral disc. So each two vertebrae are connected from the upper and lower surfaces by the intervertebral disc. Anteriorly, the anterior surface of the vertebra is connected by what is called anterior longitudinal ligament. This one. Okay, this is the anterior longitudinal ligament. The posterior surface of the vertebra is connected by this, which is called posterior longitudinal ligament. So, the two vertebrae, they have an upper surface and a lower surface. The lower surface of this vertebra with the upper surface of this vertebra, they are joined together by the intervertebral disc. The anterior surfaces are joined by the anterior longitudinal ligament. The posterior surfaces are joined by the posterior longitudinal ligament. Do you remember the superior articular process and the inferior articular process at the junction of the pedicle and lamina? These articular processes, they have articular facets, and these facets are articulates together by plane synovial joints. So the articular processes are articulated together by plane synovial joints. Now the articulation between the lamina. The lamina, if you look at this picture, this is the body of the vertebra, this is the pedicle, this is the lamina, and this is the spine. So the lamina are connected together by what is called ligamentum flavum. Here this is the spine and this is another spine. They are connected together by interspinous ligaments between the two spine, interspinous ligament, and the tip of the spine are connected by supraspinous ligament. So this is the ligamentum flavum between the two laminae. This is the interspinous ligament, and this is the supraspinous ligament. If we look at this picture, we can see here the anterior longitudinal ligament between the anterior aspect of the bodies of the vertebra. This is the posterior longitudinal ligament. This is the intervertebral disc. Remaining the transverse processes, they are connected because we cannot see them in this picture. They are connected by the intertransverse ligaments. Here, this is the lamina, this is the ligamentum flavum. Okay, between the two lamina. Here, this is the transverse process, another transverse process, and this is the intertransverse ligament. This is the anterior longitudinal ligament, and this is the posterior longitudinal ligament. Here in this picture, anterior longitudinal ligament, intervertebral disc, posterior longitudinal ligament, the ligamentum flavum, and the intertransverse ligament. Now we will speak about the intervertebral discs. The intervertebral discs, this is one intervertebral disc, and then we have a second one, a third one. So the intervertebral discs, they are the joints between the adjacent vertebral bodies, as we said before. They are secondary cartilaginous joints. They are designed for weight bearing and strength. So the intervertebral discs, they are secondary cartilaginous joint. This is the intervertebral disc. They are designed for weight bearing and strength. The discs also provide strong attachment between the two bodies of the adjacent vertebrae and permit movements. Although they provide strong attachment, they can permit movement between the two vertebrae. The intervertebral discs, they are shock absorbers. Okay, they are here, as you can see, they can move, so they are shock absorbers. The intervertebral discs accounts for 25% of the length of the vertebral column. So 75% of the vertebral column is formed by the bodies of the vertebrae, and 25% is formed by the length of the intervertebral discs. Each intervertebral disc, as you see here, each intervertebral disc consists of an outer fibrous coat, we call it annulus fibrosus, and a gelatinous central part, we call it nucleus bulbosus. So here you see the intervertebral discs. It's formed from an outside part called annulus fibrosus and an inner soft gelatinous part called nucleus bulbosus. And as we said, the intervertebral disc accounts for 20%, 25% of the length of the vertebral column. By this we finished the joints between the adjacent vertebrae. Now we are going to take the joints of the ribs. They are called costovertebral joints. Costovertebral joints. They are either joints between the head of the ribs and the vertebra, or joints between the ribs and the transverse process of the vertebra. If you look at this picture, this is a rib. Anatomically, a typical rib is formed of a head, neck, tubercle, angle, and the shaft and a costal groove. Again, head, neck, tubercle, angle of the rib, shaft, and a costal groove. The head has two articular facets. The upper one is called the superior articular facet, and this is the inferior articular facet. This is the neck of the rib. The tubercle of the rib has two parts, a smooth part and a rough part. The smooth part carries an articular facet for articulation with the transverse process of the vertebra, and this rough part gives attachment for the ligaments of the joint. So the tubercle has an articular facet and a rough part. Now we will begin with the costovertebral joints. We say that a typical rib articulates with the vertebral column at two joints. Joints of the heads with the ribs and joints with the transverse processes. If we look at this picture, you can see this is the body of the vertebra, this is the pedicle, lamina, spine, superior articular facet, and this is the rib. Okay, so the rib articulates with the body of the vertebra through its head, and it also articulates with the transverse process of the vertebra. This is the body of the vertebra. It has an articular facet or its body for articulation with the head of the rib, and here this is the transverse process. It has an articular facet for articulation with the rib. If you look at this picture, you can see several vertebrae, and this is a rib joining the vertebra. The head of each rib from the second to the ninth rib. They articulate by means of synovial joints with their costal facets to the corresponding number of vertebra, okay, and the vertebra above it. What does this mean? Let's see. Suppose this is vertebra number 6, the one which I am pointing at by the laser point. This vertebra, this middle one, we will call it vertebra number 6. And this is vertebra number 5. This rib will be rib number 6. Okay? So the head of rib number 6 will articulate with the superior facet on vertebra number 6 and will articulate with the inferior facet on the body of the vertebra number 5 and with the intervertebral disc between those two vertebrae. Let's repeat this again. If this is vertebra number 6, this is vertebra number 5, this would be rib number 6. Rib number 6 will articulate with its corresponding number of vertebra, number 6, here, okay, by the facet on the upper part of the body. And it will also articulate with the vertebra above it, which is vertebra number 5, by a facet on the lower part of the vertebra of number 5. And also with the intervertebral disc in between vertebra number 5 and number 6. To make sure that you understand this, suppose this is number 7. So what will be the number of vertebra here, the number of rib here? It will be rib number 7. It will articulate with vertebra number 7 and with vertebra number 6 and also with the intervertebral disc in between. The joints of the heads of the ribs of the first rib and of the 10th, 11th and 12th, they are a little bit different than that from the second till the 9th, because the head of the rib from the second till the 9th rib, the head has two facets as you have seen in the slide showing the typical rib. These ribs, the first, 10th, 11th and 12th, they are atypical ribs. So the head has only single articular facet. So these ribs will articulate with their corresponding vertebral body by a single synovial joint. The joints of the joints between the heads and the body of the vertebra, they have a strong intra-articular ligament. This ligament connects the head to the intervertebral disc. So here in this joint, there is a strong intra-articular ligament between the head and the intervertebral disc. This joint allows only slight gliding movement, which occurs at the demifacets, okay, at the demifacets of the head, pivoting around the intra-articular ligament of the joints of the head of the ribs. So the movement is only slight gliding movement. The costotransverse joints, they are joints of the tubercles of the rib. The tubercle of the rib articulates by a means of synovial joint with the transverse process of the corresponding vertebra. So if this is rib number 7, this is going to be the transverse process of vertebra number 7. If this is rib number 8, this is going to be the transverse process of vertebra number 8. The costotransverse joint is absent on rib number 11 and number 12, because rib number 11 and number 12, they have no tubercles. So the costotransverse joints are absent on rib number 11 and rib number 12. The costotransverse joints have 3 supporting ligaments. These ligaments are the costotransverse ligament, the lateral costotransverse ligament, and the superior costotransverse ligament. If you look at this picture, you can see the head of the rib, the neck, and the tubercle. The costotransverse ligament passes between the neck and the transverse process. So this is the costotransverse ligament. The costotransverse ligament passes between the neck and the transverse process of the vertebra. The lateral costotransverse ligament. Here, this is the lateral costotransverse ligament. It passes between the tubercle and the tip of the transverse process, between the tubercle and the tip of the transverse process. The superior costotransverse ligament, this one, it is a broad ligament. It connects the crest of the neck with the transverse process of the vertebra above. So this is the rib. The ligament arises from the crest of the neck of the rib till the transverse process superior to it. So the ligaments supporting the costotransverse joints are costotransverse ligament, lateral costotransverse ligament, and superior costotransverse ligament. The costotransverse ligament between the neck and the transverse process. The lateral costotransverse process between the tubercle and the tip of the transverse process. The superior costotransverse ligament between the crest of the neck and the transverse process superior to it. We are going now to take the movements of the joint. The movements is either a rotation movement or a gliding movement. Let's begin with the rotation movement. These are the vertebrae and this is the rib. Okay, and this is the sternum. The rotation movement occurs around a transverse axis, a horizontal axis that passes through the head and neck of the ribs. Which ribs? The upper 6 ribs. So, first, second, third, fourth, fifth, and sixth. So, rotation movement occurs along or around the transverse axis. This axis passes through the head and neck of the upper 6 ribs. This movement results in elevation and depression movement of the sternal end of the ribs. This is the sternal end of the rib. So the rib either goes upwards or downwards. Upwards or downwards, like these dotted lines. Okay? So it causes the sternum to move up and down. This movement we call it pump handle movement. So rotation movement again occurs around the transverse axis, which passes through the head and neck of the upper first 6 ribs. This results in elevation and depression of the sternal end of the rib, causing the sternum to move up and down. This movement, as we said, it's called pump handle movement. The other movement is called gliding movement. This is the rib. This movement causes elevation and depression of the lateral part of the rib, not the sternal end, no. The lateral part of the rib in a transverse plane, like a bucket handle movement. Like a bucket handle movement. Also, it goes up and down. So this movement is called gliding movement. This picture shows the rotation movement for the upper 6 ribs, and this is the gliding movement. It occurs at the lateral side of the rib. Now test yourself. enumerate the supporting ligaments of the costo-transverse joints. This is the summary of the lecture, and by this we come to the end of the lecture. Thank you very much.